What is postpartum depression? Postpartum depression may be mistaken for baby blues at first, but the symptoms are more intense and last longer. These may eventually interfere with your ability to care for your baby and handle other daily tasks. Symptoms usually develop within the first few weeks after giving birth, but they may begin earlier, during pregnancy, or later, up to a year after birth. Childbirth is a difficult and exhausting process. A female goes through a lot of hormonal, physical, emotional, and psychological changes throughout pregnancy. Tremendous changes occur in the mother's familial and interpersonal world. After childbirth, a mother can experience varied emotions ranging from joy and pleasure to sadness and crying bouts. These feelings of sadness and tearfulness are called baby blues, and they tend to decrease over the first 2 weeks after delivery. Baby blues usually begin within the first 2 to 3 days after delivery and may last for up to 2 weeks. But some new moms experience a more severe, long lasting form of depression known as postpartum depression. Now, what is postpartum depression? Depression suffered by a mother following a childbirth, typically arising from the combination of hormonal changes, psychological adjustment to motherhood, and fatigue. Postpartum depression is a crippling mood disorder, historically neglected in healthcare, leaving mother to suffer in fear, confusion, and silence. PPD presents with symptoms of classical depression including mood fluctuations, bouts of crying, lack of interest in the child, and even thoughts of suicide. PPD not only has adverse effects on the mother's health but also hampers the growth and development of the child. A previous history of depression or psychiatric illness, depressive symptoms during pregnancy, gestational diabetes, and lack of spousal and social support were the most powerful risk factors. According to Beck in 2006, as many as half of PPD in new mothers go undiagnosed because of conflict in privacy and not wanting to disclose to close family members. There is also a stigma around new mothers in that disclosure may lead to abandonment and fear of lack of support. The symptoms of baby blues, which last only a few days to a week or two after your baby is born, may include mood swings, anxiety, sadness, irritability, feeling overwhelmed, crying, reduced concentration, appetite problems, trouble sleeping. And postpartum depression symptoms include depressed mood or severe mood swings, crying too much, difficulty bonding with your baby, withdrawing from family and friends, loss of appetite or eating much more than usual, inability to sleep called insomnia or sleeping too much, overwhelming tiredness or loss of energy, less interest and pleasure in activities you used to enjoy, intense irritability and anger issues, fear that you are not a good mother, feelings of worthlessness, shame, guilt, or inadequacy, reduced ability to think clearly, concentrate, or make decisions, restlessness, hopelessness, severe anxiety and panic attacks, thoughts of harming yourself or your baby, recurring thoughts of death or even suicide. When to see a doctor? It's important to call your provider as soon as possible if the symptoms of depression have any of these features. Symptoms don't fade after 2 weeks. Symptoms are getting worse. Symptoms make it hard for you to care for your baby or make it hard to complete everyday tasks. Symptoms include thoughts of harming yourself or your baby. Depression may not recognize or admit that they are depressed. They may not be aware of signs and symptoms of depression. If you suspect that a friend or loved one has postpartum depression or is developing postpartum psychosis, help them seek medical attention immediately. Don't wait and hope for the improvement. At home practices like eating a healthy diet, regularly engaging in gentle exercise, practicing meditation or yoga, and spending time in nature may help. You feel better, especially when used alongside traditional treatments like medications and therapy. So, that was all about postpartum depression, which is becoming a breakthrough in our lives, in our new moms' lives. So, be careful, be attentive, and don't forget to subscribe to my channel. Thank you.